Good morning and good afternoon, everyone. I am Carmen Hughes, and you are here to listen to Health Information Exchange, improving efficiency, quality, safety, and cost of patient care. Thank you for joining us today. A little information about HiBridge HIE. HiBridge Solutions, which you may know as formerly HiBridge or Georgia High Tech, is a program that's within the Health IT division, the National Center for Primary Care at Morehouse School of Medicine. That's a mouthful. Our division, through our amazing team, offers an array of services to provide education and technical assistance to primary care stakeholders throughout Georgia, the state, and the region. And we're really focused on using digital health technologies in primary care delivery. So this not only includes technical support, but it also the academia associated with the building blocks of health information exchange and interoperability. Of course, being here at Morehouse School of Medicine, we want to make sure that we include the academia of technology and health information exchange. And those are also, we want to make sure that we're aligned with the priorities of the National Center, the Office of National Coordinator for Health Information Technology, also known as ONC. We like to say, and we've epitomized that our goal is to optimize patient information management through technologies for the successful transition of value-based clinical models and better health outcomes. We partner with various systems, healthcare systems and organizations across the state of Georgia and abroad, outside of Georgia, including the Department of Community Health, the Department of Public Health, the GHIN, of course, the state designated HIN or Health Information Network, and then many other community and professional organization partnerships that we have. So give you an idea, I'm gonna switch the slide. Today, you're gonna have three dynamic presenters, and we're gonna have fun today as we talk about health information exchange. I, myself, Carmen Hughes, serve as the director of the Health IT division at Morehouse School of Medicine. Also serve as the director for the Health Information Exchange, HiBridge HIE. We have Phoebe Nelms, who is our associate project director, and Cameron Fletcher, our director of technology and technical services. So welcome to both Phoebe and Cameron. Phoebe's name badge says HiBridge Solutions, but we know that she is Phoebe, and so we're excited to have both of you all join us today. And we have a great number of folks on the line, so we're excited about the participants who joined us as well. So today, we're going to focus on, obviously, the HIE of our division. So we'll talk about the review and the use of health information exchange. Of course, we'll talk about HiBridge and the value that it brings and the services that are offered through the HIE. We're going to understand the benefits of utilizing the HIE to exchange data in patient care delivery, and a review of the importance of ADT alerting. And one thing that I failed to add here is we're actually going to have a screenshot demo of our patient or our portal, our HIE portal. So again, excited to have that as well. So we will jump right in. So who is HiBridge HIE? And in 2014, we established our own regional HIE here at Morehouse School of Medicine, connecting our statewide regional health information network. We're connected to them as a regional GHIN, as I just mentioned, Georgia Health Information Network. We're actually one of 4 regionals connected to GHIN, and the only one that's open to all who want to connect is how we say it. We're not limited to geographic constraints. We're not tied to specific health system or provider specialties. We're open to all EHR platforms as well. And over the past year, we've invested in a more robust technology platform as our HIE engine. So we're real excited about that. Our new technology partner in our engine is NextGen Health Data Hub, or you'll hear it's referred to as NextGen HDH. It's a US-based technology company, as well as they have an international presence. And through this, we offer a cloud-based service for our HIE that Cameron will talk more about. But you also may know NextGen for their EHR technology. They've been in that space for quite some time and leading in the electronic health record technology. So our goal is electronic exchange and interoperability. We want to make sure that, you've heard the adage of the right data for the right patient at the right time. That is our motto. We borrowed it. We continue to use it because we want to make sure that we want to improve patient care through the exchange of data and having the right data for the right patient at the right time. So when you think about the benefits, and these are generic of sorts, but of course some are tailored to HIE. But the benefits, the interoperability goal is to ultimately improve the healthcare quality and outcomes, avoid costly mistakes, and reduce health-related costs. So HIE was created to support smaller practices and hospitals in everyday use of the electronic data exchange at the point of care. Our goal and our mission within Morehouse School of Medicine is to eliminate health disparities and have health equity and create health equity. So through all the work we do here in MSM and the Health IT division, we want to make sure that we are following that mission and motto. So we do service and work with education and training and other solutions with small-based practices in maybe underserved areas. It's really our focus, small hospitals. We know that studies have shown that providers and practices and healthcare systems in lower communities are often left behind with technology. So again, our goal is to make sure that we keep everyone up to date through the use of technology platforms. And so connecting and data exchange through HIEs allows providers to better track and securely share patient information, including complete medical histories, referrals, allergies, medicines, et cetera. Again, for that better quality of care and continuity of care. The goal is to eliminate redundant or unnecessary testing and duplicate treatments is one of the goals. And very important, data and record sharing goes a long way in improving patient safety by reducing medication errors and medical errors that come when data isn't often shared. And so I don't know about you all, but for me, when I go to the healthcare provider, I have to often say, oh, can't you check that? Or, we're in the same system, but even if we're not in the same system, my referring physician, I bet if you check your HIE, you'll be able to extract that data. I remember just recently I went for an immunization and they asked me about my immunization record for here in Georgia, and I've been in Georgia for over 30 years. And I said, I think you can go check grits for that. Oh yeah, that's a great idea. I don't know what immunization I had 20 years ago, but if you check grits, I was here in Georgia at that time, so you can check the immunization records there. And so it's like, oh, that was an aha moment. But that kind of lends itself directly into the big picture. And you may have seen this graphic before, but I like to say in this big picture, the HIE network is really the superhighway of patient data exchange with the goal of having the right patient, again, the right info for the right patient at the right time. Something we say over and over, which is extremely important. But looking at this hub and spoke model, you'll see that we want to make sure that the health information network, and in this case, GHIN is sort of the center of that for the state, but connecting to labs and other social organizations, the state itself. It helps with clinical decision supporting, public health. We just talked about grits, medication reconciliation, hospitals in smaller areas and large communities as well, in urban and rural areas. So just having that whole network of services connected is extremely important. And again, we serve as, on this graph, it's looked to be as what we call a service area HIE. The name changed over time. It's a regional HIE, but we do cover the state and beyond. So to take that and drive it down a little bit differently, to look at HIE, this is our infographic specific to HIE that we've created to really kind of demonstrate how we function and what our reach is. So through HIE HIE, we have connections and exchange with independent ambulatory services or ambulatory practices, smaller rural hospitals, and other organizations throughout the state. Anyone our goal is really to connect anyone who's involved in the coordination of patient care delivery, including payers. We've excited that we've brought on several correctional care facilities in the state through our partnership with WellPath. As we often say that, folks don't go into a correctional facility with their medication history or the diagnosis history. So having that information at the point of intake is extremely important in this environment. So we want to make sure that we have connected with them as and also the Georgia Department of Corrections. So we have about 70 facilities in the state that are currently connected. Let's see, we also have the at the scene for first responders. We have that data available for at the point of care service for care delivery. And we also help to create communities of care networks in areas where there's no or limited electronic data flow among the healthcare continuum of care for those particular areas. So it could be a small hospital in a rural community with primary care clinicians attached or connected, as well as specialists, because again, that data is just not flowing. So we try to be that conduit. They may not have an interest necessarily in what's happening in the state of, not the state of Georgia, but in Metro Atlanta, but they really care about what's going on in a small rural community in Middle and South Georgia. And that data is just not flowing. So we try to make sure that we have the opportunity to have data there for patients in, again, small rural communities as well. Rural hospitals to primary care specialists, home care services, et cetera. Through the HIE, we also provide the aggregated patient record that Cameron will talk more about, medication history through our partnership with Dr. First, performance dashboards, lab and radiology, electronic orders. But anyone that GHIN is connected to, we also pass that data through. And that's what we call external data, but it's extremely important. And that's why most facilities connect with HighBridge HIE is for, of course, the data that's outside of HighBridge. So the GHIN connections being that they are the state entity. So, and I'll show you a list of those as we move forward, but they're able to exchange with most larger healthcare systems, such as Grady, Wellstar, Emory, Children's Healthcare, other care management organizations, and then other state organizations as well, such as the Department of Behavioral Health, Juvenile Justice, Public Health, and that's just to name a few, as well as some larger specialty clinics like DaVita, Harbin Clinic, and also the National Health Information Exchange, eHealth Exchange. So last count, and I need to go back and connect that, but I think there's over 32 million unique patient records exchanging through GHIN. So it's a great amount of volume. And we know that HIE is only effective at the point of care as the data that's available. So again, we want, regardless, and I have to say, regardless of the technology that's available. So it's the data, so we can have the best technology in place, the smoothest transitions, but if data isn't flowing for your patients, it's not valuable to you. So we want to make sure that the data is valuable and get information out to you at the point of care. We also offer various levels of connections, and we'll go through that in just a second. But again, the ultimate goal is interoperability. So the list I'm showing now is actually an updated list of Georgia, of GHIN's connections, and GHIN has two products, which is direct messaging, and also the Georgia Connects, what used to be, I just lost the name of it, but it's Georgia Connects. That's the query-based system, and that's what we are connected through from the HIE perspective. So you see the state agencies that I mentioned, the larger health systems, again, Children's Healthcare, Emory, Grady. The newest one is very exciting is Northside and all the Wellstar facilities, and of course the Harbin Clinic. There are other regional HIEs, as I mentioned, in the state. There are 4 of us. We're the only one that's sort of independent and not affiliated with the health system or geographic location, as I mentioned. The CMOs, the care management organizations, AmeriGroup, CareSource, and Peach State are the 3 that GHIN has connections with. and the United Digestive System is one of the specialty connections. The e-health exchange, the national exchange, there's several connections, and that's valuable information, particularly as people are transient. People are getting out more lately, and so having data available with that correctional facility population, having data as people are transient, and that maybe that particular population, having data being pulled if they were in an adjacent state or across country. And I remember being at a HIMSS conference several years ago, and I heard George Bush speak, and he talked about, he laughed and he said, I want to make sure that my data was, patient data was available if I were in Texas or if I were in DC, that my physician, of course he's president, but my physician in DC could pull the data for when I was in Texas, my health record, or any other state. He said, now I probably didn't call it interoperability then, and because he said, that's a new word for me, but I want to make sure that patients and folks had data available, their patient record data available whenever they needed, wherever they were. So that's how this kind of came about, of course, through the HITECH Act. But the national exchange data is invaluable. And so as GCAN continues to have their connection with the national exchange and more folks are coming onto the eHealth exchange, more data is available from a national perspective. We have an organization that is connected with us who has offices in both Alabama, Florida, Georgia, and Tennessee. And so with us, with one connection, they're able to extract and pull data from the various states that are connected to the HIE or into the national exchange, and with one connection. Again, same thing with WellPath and the Department of Corrections. So having that information is extremely, extremely important. And so there's also other aspects when you think about data exchange that's valuable. As you all know, there was meaningful use. Then it moved to promoting interoperability. There's the macro MIPS and quality payment program. And there are requirements within those products and those services, that's not the word I'm looking for, the regulations that are extremely important coming in from ONC. So we want to talk a little bit about how we, through the Health Information Exchange, support the requirements for MACRA and the MIPS program. So for that, I will turn it over to our resident expert on the quality payment program, because we do provide services and education and training to the small, underserved, and rural practices in those particular areas. So Phoebe is our resident expert here at Highbridge, and I will turn it over to her to really talk about how the HIE aligns with the requirements.
Thank you so much, Carmen, for laying such a beautiful foundation, groundwork for me to talk about this. As you mentioned, Health Information Exchange is something that's a part of the quality payment program, incentive program, by which the Centers for Medicare and Medicaid Services, working in conjunction with the Office of the National Coordinator, are really trying to encourage everyone to utilize Health Information Exchange. And I just want to put a plug in for our name. We are Highbridge. We are your health information bridge to connect you all, so that you can have that patient information at the right time, to impact quality of care. So that's how it relates to the quality payment program. So in order to meet the promoting interoperability requirements, for those who are participating, you're so familiar with all of this. For those who do not have to participate, there are 4 categories in the quality payment program: quality, promoting interoperability, cost, and improvement activities. So under the promoting interoperability category, there are 3 options listed, 3 measures listed. PI-HIE 1 is health information exchange by supporting electronic referral loops sending health information. So that requires that the clinician, for at least one transition of care or referral, that the MIPS eligible clinician that transitions or refers their patient to another setting of care or healthcare provider, number 1, creates a summary of care record using their certified electronic health record technology. And the second part of that is they electronically exchange that summary of care record. So to kind of bring it down to a patient personal level, let's say my dear Aunt Mary, she goes to her primary care doctor and he refers her to a cardiologist. Well, her primary care would send an electronic summary that at a minimum includes her current problem list, an active current medication, allergy list, and any other known allergies or other diagnoses. And so that would help the clinician receiving the information. And so the other part of that, the other measure would be health information exchange supporting electronic referral loops by receiving and reconciling the health information for a patient for at least one electronic summary of care record that's received for patient encounters during the performance period, for which the MIPS eligible clinician was the receiving party of a transition of care or referral, or for patient encounters during the performance period in which the MIPS eligible clinician has never before encountered the patient. And so they would conduct clinical information reconciliation for medications, medication allergies, and a current problem list. So dear Aunt Mary, once she went to the cardiologist, he would then send back the information electronically to her primary care provider so that there would be that smooth flow of what the outcomes were, what next steps would be, so that they can coordinate care and have a full picture of what's going on with Aunt Mary. So now another option is really focused on using the HIE, health information exchange, bi-directional exchange, and this one really utilizes hybrid solutions, HIE. The MIPS eligible clinician or group participates in an HIE to be able to exchange electronic health information for every patient encounter, transition, or referral, and record stored or maintained in the electronic health record during the performance period. So the health information exchange that they participate in has to be capable of exchanging information across a broad network of unaffiliated exchange partners, including those using different EHRs, and it wouldn't exclude anyone as an exchange partner. And so they would use the functionality of their electronic health record to support this bi-directional exchange with a health information exchange. So this would make it even easier. Aunt Mary's information would travel between places of service using the HIE as an information bridge. And that really is true interoperability. And so we know from experience that different systems don't really talk to each other, but this overcomes that obstacle, that barrier. So we can see that there are definitely benefits, not only for the promoting interoperability category, but also across all the categories in the MIPS program, those who are required to participate. And so it really does have the potential to increase care coordination and improve the quality so that those specialists can really have the adequate information to get a good picture of what's going on with the patient that's referred to them. And it really avoids duplication of testing and things like that. And then in reverse, the primary care physician can get information back about what happened at the visit that they referred the patient to. So this really increases efficiency, it saves time, it reduces burden on staff because the referral process can be quite time consuming for staff. And they have to deal with many different processes, and sometimes information gets lost. So it really does improve the completeness of the patient record that can be jointly viewed in that patient's electronic health record. And of course, there are the cost savings from, and Carmen mentioned this earlier under the benefits, because it decreases duplicate testing, It's even been shown to reduce readmissions to the hospital because of the increased coordination of care, improved diagnoses, and then the ability to code to reflect all the comorbidities and diagnoses that may happen in different places of service to ensure that that patient is correctly risk stratified. And that, of course, impacts the cost category of the quality payment program. And practices need all the revenue that they can generate to be sustainable and to continue taking care of their patients. And of course, it really is about the patient. And so having accurate, complete information on each patient that you can access readily without excessive delays in time is really about safety. You can verify what medications have been prescribed to the patient, whether they have allergies to any particular drugs. You can avoid duplicating prescriptions in the same pharmacological class, which is, with the older population, the Medicare population, they have so many medications. It's great to have a full picture of what they're taking. Not only the individual drugs, but all the drugs in a specific class. And it improves information, access to laboratory information, what tests have been ordered, viewing the results that have been received, and just makes the patient record much more complete. And I like to go back to the old saying everybody uses, knowledge is power. So increased knowledge and health information exchange gives a clinician greater power to be effective in their treatment of their patients, and sometimes also helps the patient have more insights and power into managing their own health. So with that, I will turn it over to our resident technical genius, Cameron, to
Thank you.
take us home.
Yeah, absolutely. So Carmen and Phoebe have done a great job of outlining what we do and why we do it. And so I'll kind of step in and talk about how we do it. So when it comes to Aunt Mary and her getting referred to multiple practices and different specialists, it's really important that at an HIE level, what's considered to be multiple patient records across multiple facilities, it's really the role of the HIE to take all of that disparate data and aggregate it into one single source of truth record that can be accessed by anyone throughout the state. And so that's one of the primary functions that we have within our platform in the network is this. We take all of these disparate CCDs and clinical summary documents from practices that we're connected to both through GHEN and direct connections within our network and build these aggregate records on patients like Aunt Mary who have gone to multiple facilities. And so that's one of the key pieces of the work that we do. In addition to collecting information from facilities that we're directly connected with, to Carmen's point earlier, you saw the list of all of the connections that we have through our affiliation with GHEN, the state organization, and all of the data repositories that opens us up to in receiving state data and hospital system data and even some specialty data through the eHealth exchange. And then the third kind of component of our core products and services is medication reconciliation. So referring to Phoebe's last point about having a full complete list of medication fill history is really important for some of the demographics that we serve, including those who are incarcerated or might be elderly and they might have a lot of medications. It's really important that providers, when treating patients or seeing new patients, are aware of medications that are currently being taken. And so we connect with Dr. First's medication history platform to pull medication information from all over the nation. So this isn't just within Georgia. We're connected to pharmacies all over the nation through Dr. First. So clinical content management. Obviously, as an HIE, we get all sorts of data from all sorts of facilities, and it's really important that we offer storage and can host all of that data for our providers and clinicians who are connected And so that goes beyond just storing information like problems, medications, and allergies. We've got to go the extra step of capturing immunization data and family history or functional statuses, clinical item types that typically are in the EHR but might not always make it to every health system. So it's really important to us that for clinical content management, we accept and can render and store any of the information that is sent our way. One of the other ways that we manage clinical content is specifically patient records. So on the previous slide, the idea of aggregating patient records across multiple facilities. One of our core offerings is and products on our platform is how we manage and reconcile patient matching. And you've got two patients with similar names, similar date of birth, similar addresses. We have systems in place that will automatically match those records and make sure that patients get aggregated as they should. And along with that comes consent and data protection and having the proper measures to make sure that we can enforce consent when the patient chooses not to opt into data sharing, placing consent in effect notices on their records and making sure that nothing gets shared without the patient's consent, and access to meaningful insights. Having all of this data aggregated under one roof instead of multiple different data silos enables us to work with our providers and clinicians to understand what kind of insights are meaningful for you in your practice and what kind of data do you need to know at that 30,000 foot level that you might not necessarily be able to see within your EHR, and allowing us to do some meaningful reporting, especially around COVID. With the state was one of the projects that we recently just worked on in aggregating COVID conditions across the state and reporting those totals over time. So none of that would be possible without that strong platform backing us that Carmen had mentioned earlier, NextGen Health Data Hub and NextGen Connect. So when we are talking with practices that are interested in coming on board the HIE, we kind of split these levels or split this integrations into levels of connection. And depending on your system or your EHR, that typically determines what level of connection and how far integrated we can get you with the HIE. Level one is being ADT alerts. ADT alerts, admit, discharge, transfer from some of the larger health systems in the state. When patients that, you have a patient and they present to a hospital, you want to know about that. You want to know that patient was just admitted to a hospital. And so this is kind of level one of that connection. We can deliver that to you via your EHR if they support it, or direct message, or within our clinical viewer, we can relay those notifications. Level two kind of expands upon that with portal view access, kind of allowing you to view what your patient's aggregate record within the network is at any given time, and accessing that external data that Carmen was talking about from GHEN, the eHealth Exchange, and Dr. First for medication history. Portal view access is perfect. We sometimes do integrations directly into your EHR, where you can be on a patient's chart and click on a button and open up their record in the HIE, all with a click. That's typically where all integrations start. Even if you are planning on connecting further, everybody will have access to the portal as a part of a connection with HiBridge. And that will be used, to kind of get data flowing while we're sorting out the more technical bits of further integration. Like level 3 through 5 is all workflow integrations, right? And so level 3, that bidirectional data connection, very similar to what Phoebe was talking about. That's where HiBridge is receiving clinical data from your practice, your EHR, automatically. And this is either done on, nightly batches, or as an encounter gets signed off in your EHR. So near real time, and then receiving data through your EHR at EHR querying integration, where we can, have your EHR query us directly through query-based exchange to receive data that can be reconciled directly onto your patient's chart within the EHR. And then taking that a step even further is full automation and scheduled querying. So really getting tightly integrated with your EHR and the scheduling system within it to make sure that, as Carmen and Phoebe have both said, the right data is on the right patient at the right time, and making sure that based on if you've got appointments coming in for the next day, let's go ahead and get that data before you need it so that it's ready for the clinician or provider who will be seeing that patient when the patient's actually sitting in front of them. So kind of starting back up at the top again, ADT event notifications. I described it a little bit, but ADT event notifications are essentially summaries of when a patient is admitted, discharged, or transferred from a large health system within the state of Georgia. All of these interactions, as you can see on the graphic on the right, all of these interactions kind of produce an event notification that we receive from the state. From there, because of our health data hub and our master patient index, we know what patients have relationships with your providers and your practice. And if we notice that there's an overlap in a patient of yours from a state, we're receiving notification from a state facility on a patient that overlaps with someone that you see, the system will automatically route that notification via direct message or the clinical viewer, or even a custom integration to the EHR to the provider who has a relationship with that patient. And this really enables that proactive care coordination and knowing when a health event happens outside of the system that you have direct control over, and kind of bringing everybody into the loop when something happens. That the next step beyond just a portal integration is what an EHR integration looks like. So this integration resides completely in your EHR, the system that you're already familiar with. And when you're on a patient's chart, we work with your EHR vendor to establish an integration that allows you and your providers to exchange CCDA documents or consolidated clinical document summaries on patient records throughout our entire health network. And you can see on the right, you can see those data sources that we connect to, GHEN, Dr. First, and HIE members. And then the GHEN community network even expands further with the eHealth Exchange connection. So multiple different state communities. And when you ask for data on a patient, that request goes right to HighBridge, and we immediately federate out in that kind of hub and spoke model. We'll federate out and ask all of our connected participants, hey, is there any data on Aunt Mary? And if so, can we send that back to the chart so that a physician or a clinician can reconcile that data and have it available for when they're presenting at the practice. Just to give you a general idea of integration timeline, this is really for levels 3 through 5 when we're working to establish a workflow integration into your EHR. Typically starts like all projects do with a project kickoff. Then we go through provider onboarding at around the same time, in which we get your providers access to that clinical viewer so that they can immediately start accessing data within the network even prior to the integration being completed. At the same time as that, in parallel, we also do technical scoping with your EHR vendor to really understand what needs to be done in order to make this connection happen. We've worked with many vendors. They're all different. Each system, no two systems are the same, even within the same product. So it's really about understanding what are the capabilities of your current system, what are the limitations, and how can we navigate those in order to get where we want and get this data flowing. Once we do that technical scoping, integration implementation commences. And HighBridge begins working directly with your technology vendors along with you to ensure that data can exchange using query-based transactions, all under the standard IHE transactional models. And then we enter testing, pre-production and production testing, and support and maintenance. And then data at that point is flowing to your EHR when you need it. It's a really seamless integration, putting that data, being able to request that data where you're already familiar with seeing it and reconciling it, is overall the end goal of all of our connections, is to integrate as deeply as we can with your given systems. So just to give you a few screenshots, I know I've talked a lot about this clinical viewer, but I'll just go through quickly. This is when you log into the clinical viewer, all of your clinicians and providers will have their own logins to this system. It's a web-based portal. So this is where we can integrate into your EHR or integrate into your existing systems via embedded browsers. When you log in, you're presented with kind of a general dashboard that you can use to search for patients within the HIE network, either by demographics, so first name, last name, date of birth, or the patient's MRN in your EHR or EMR. And you'll be able to see patients within the HIE through this search. This is what it looks like. I know I talked a little bit about consent. When patients opt out of HIE sharing, this is what consent looks like on that patient record. You can't see any data. This patient in particular has overridable opt-out, meaning that in cases of emergency, this patient has elected to allow their consent to be overridden if there's emergency treatment. This is what a bunch of our test patients look like, and all of the data you can see when you search. You can see the first name, gender, date of birth, home address, city, and patient ID at a glance. If you were to click on one of those records, you would see that this is what it looks like when you're actually on a record. And this is that consolidated aggregate record that I was talking about in the first slide that I had, where we've taken data from multiple disparate data sources and kind of summarized them into these neat little clinical item cards that allow providers and clinicians to look at a glance and see medications that a patient might be taking, or any prescriptions or lab results that have recently been taken. Of course, you might need more information and context than what is immediately present on the screen, in which case you can click on any of the data that you see on that first screen when you are on the aggregate record to kind of jump in and dig down and see, when was this data received? Who notified the HIE of this data? What data source did it come from? What code? What's the code for the allergy in this case? When did it start? What is the reaction? Who's the observing provider? All that critical information that you might need at the point of care is all present for you in this kind of clinical item detail page. And then another example, this is with a lab result. You can see the providers that were authoring, ordering, and verifying, when it was collected, the status of the result, place order ID, filler order ID, the status, and then, of course, the most important piece is the observations along with the interpretations. As Carmen mentioned, a lot of our clients are using the HIE to access external data through our federated vendor connections. And this is an example of what you might see on a patient that has many documents available through GHIE. You can see the AmeriGroup Care Plan, medical records, Healthy Connection Aggregated CCD, Emory, the GHIE web client. All of this information is available through our federated connection with GHIE and Dr. First. Any questions on anything covered? If not, I think that's all from me.
That was a great run through. And I know it's very high level as you went through it, Cameron. Thank you so much. That kind of, again, gives a good feel for what the HIE data looks like, and the processes by which it's available.
Mm-hmm.
Great information. Phoebe, I'm trying to see if I see any questions that have come through. I think, again, we want to make sure we talked about the focus, the importance, what's available, and how they meet the requirements for the quality payment program. Phoebe, I will turn it back over to you to cover our last bit.
Thank you. So much of the information we covered, here are links to our resources. If anyone is interested, we can send that out to you. Just put it in the chat to request. One of the things that we like to help our audience do is keep up with trainings in the health information space, or even just to meet certain HIPAA requirements that may be necessary for you to do annually for staff training, and also for programs like the quality payment program. Or so many options are available with our partner for Med Approved. They have many courses, and if you use this link, we can provide you with a 20% discount. So we hope that you'll take advantage of that for med training. I'll put it in the chat later. We hope you'll utilize it, especially to do the annual HIPAA training for staff, because they generate a certificate for you to keep on file. There are some upcoming opportunities for you to participate for any clinician, an MD, a DO, RN, NP, or PA practicing in a U.S. primary care setting. They can receive a $30 Amazon gift card by telling your stories about HIV and COVID screening and testing. It's called the 2-in-1 program. And I stuck the link in the chat earlier, so I'll just hit send so that you can access it in chat to take advantage of that. And you can use the handy dandy QR code in the other opportunity, Center for Leadership and Disability Training opportunity. It's a way for providers to get training on how to interact more effectively with individuals with disabilities. So this is also a great opportunity, and we'll leave that up for just a moment so you can use your phone and access the information through the QR codes on the screen. Hopefully that will work for you. If not, just reach out to us and we'll be glad to forward the flyers to you directly. We want to thank all of you for joining us today. It's been a pleasure sharing this information with you. We hope that you find it actionable, and will reach out to us for more information if you have any questions at all, or if we can support you in any way. That's why we're here. It is our pleasure to be that health information bridge for all of you and for all your patients. So coming up, we have webinars every month. Our next one will be on November 15th, the third Tuesday. Let's talk EHR utilization, using technology to maximize patient care, especially around chronic illnesses. This is a very important way to use the electronic health record to improve and address quality and make sure no patients fall through the gaps. So we look forward to presenting that information to you coming up on November 15th. So thank you so much for joining us. Here's our contact information. Feel free to reach out. We'd love to hear from you, and let us know how we can support you in any way.